So let's take a quick look at the kidneys and have a look at their location and their structure, and then also have a look at the urinary system as a whole. So when we talk about the urinary system or renal system, we talk about the two kidneys that we have. So remember, the kidneys are this bean-shaped organ around about the size of the hand to about the second knuckle. They're connected to two ureters, which you can see here, are two tubes that travel down to the one bladder, which is a storage unit for our urine, and then one urethra, which transports that urine from the bladder out to the external environment. So again, two kidneys, two ureters, one bladder, one urethra. Okay? Now, when we have a look at the location of the kidneys, you can see that they actually sit relatively high up in the body. Now, they don't sit towards the front, they sit towards the back. So they actually sit behind the peritoneum. Remember, the peritoneal cavity is the cavity that holds the majority of the GIT, the gastrointestinal organs. Okay? So in that, you could say that the kidneys sit retroperitoneal, behind the peritoneal cavity. Okay? And they actually sit at the back of the abdominal wall. Okay? Now, sitting towards the back of the abdominal wall, the top of the kidneys are actually resting upon the diaphragm as well. And if you were to have a look at the kidneys, and I haven't necessarily drawn them as well as I probably should have, but you should see that the right kidney sits a little bit lower than the left kidney. And the reason why the kidney on the right sits a little bit lower than the kidney on the left is because remember that you have that large liver on the right hand side that pushes that kidney down. So the right kidney sits a little bit lower than the left. Now in this image you can see that I've drawn the skeletal system from a posterior view, and you can see the pelvis here, and you can see the vertebrae coming up, and you can see two ribs. So looking at this, a couple of reasons why I've drawn it like this is because you can see that the kidneys aren't very well protected by the rib cage. Okay, your lungs are, your heart is by the sternum and rib cage, but the kidneys aren't. In actual fact, you can see that this is the last rib, the 12th rib that you can see here. 12th rib, and part of the 11th rib protecting the kidney. Now, it doesn't actually protect it very well. In actual fact, this can be more dangerous than helpful. A lot of patients may come in from car accidents, and the way that the car crashed and the way that their body twisted, that rib can snap and actually sever the kidney. Now, because of this fact, the kidneys, among other reasons, are surrounded, and I haven't drawn it here, by a lot of fat. And now this fat that's surrounding the kidneys is called perirenal fat. And this perirenal fat isn't like the type of fat that you put around your belly and around your thighs and around your bum. This is functional. Well, that fat that you put here is called functional fat, but the fat that you have around the kidneys is called structural fat. There is a difference. Functional fat we use for energy. Structural fat we often use for protection and anchorage, for example. And that's exactly what this perirenal fat does. It protects the kidneys because the ribs don't do a very good job of that, and therefore it's very open to being hit at the flank. And it's there to anchor the kidneys as well. So keep the kidneys where they are so they don't start floating around. There's been a number of reported cases in which patients have come in and they've had scans done and their kidneys are floating around. Now, why are their kidneys floating around? Well, they found that a number of these patients were either malnourished or they were marathon runners, for example. Now think about that. When you're a marathon runner, think about how much energy you use. And if you're not eating appropriately, well, what could happen is that you move through your glucose, glycogen stores, and you start to move on to your fat stores, and you go to your protein stores, and you get muscle wastage. But if you've used up all your fat stores, which is very hard to do, your body starts to move from that functional fat to that structural fat. And some of these patients have had the structural fat around their kidneys started to get broken down to use for energy. Now, without this fat that's anchoring the kidneys, these kidneys can start floating around. Okay, so we have the kidneys sit behind the 12th rib, sit at the level of the 12th rib. You can see here, and goes down to around about the third lumbar vertebrae. So 1, 2, 3, 4, 5. So 1, 2, third lumbar vertebrae, L3. So between the 12th rib and the 3rd lumbar vertebrae is where these kidneys sit, and again attached to the ureters, bladder, and urethra. Now, let's have a closer look at the kidneys. So let's draw up the kidneys and let's section in and see what we can find. So if you were to draw the kidneys up, you can see that the kidneys are made up of two predominant layers. An outer layer, which I've drawn here, which we call the renal cortex, and an inner layer here, which we call the renal medulla. You can also see that there's like an entry and exit point here, which we call the hilum. Now this hilum is where we have, you can see here, the ureter coming away, also have veins coming away, and lymphatics as well, and it's also where we have the artery, renal artery coming in. You have the abdominal aorta, the descending abdominal aorta with a renal artery branch that comes out. Okay, and I'm not going to draw that yet, but I'll draw it shortly. When we have a look at the medulla, you're going to see a couple of things. First thing you'll see is that there are a number of pyramids that are located here in the medulla. Now we call these renal pyramids, unsurprisingly. And you have between 8 to 12 of these renal pyramids. So you have the renal cortex, then you have these renal pyramids, and they've got these striations, these lines through them. And you can see between them, you have these renal columns. And in actual fact, these renal columns are extensions of the cortex that come down. And these renal pyramids, what you'll find, are connected, and I'll draw it in a different colour, to like little cups. I like to think of it as your hand, placed like this, as though you were asking for somebody to pour some water into your hands and you were to hold it like that so you could hold the water. That's what these are like. And these are called a calyx, or calyces to be plural. I'll write that down. Calyx. And calyx does actually mean cup. Now these smaller calyces are called minor calyces. But what you'll find is that these minor calyces all connect up with each other. And what do these minor calyces form when they connect up with each other? Well, they form a major calyx, a major cup. And that this major calyx forms a funnel right here, which is called the renal pelvis. Now what's the whole point of having these little cups here and this big cup here and this renal pelvis here? So minor calyces, major calyx, and then renal pelvis. Well, that's because when our kidneys filter the blood to create urine, what happens is that the majority of it happens here in the cortex, and the urine or the filtrate that's been made drip down these renal pyramids, drip, 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 drip into the minor calyces, which then all pull into the major calyx and goes to the renal pelvis. And then where do you think this goes from the renal pelvis? Well, this is the ureter. Remember, you have two kidneys, so we're just highlighting one particular kidney here. Okay? Now, I just said that we take the blood in and we filter it from here. So that means that there must be an artery coming in, which we do have. Remember, you have the descending abdominal aorta with a renal branch that comes in. Now this renal branch will split here and segment and go towards the back and towards the front, and will continue to branch and branch and branch and branch. If we were to look at these branches, okay, what you'll find is as it branches, and this image is going to start to become a little bit messy, I'm sorry. So as it branches, you'll see that it starts to branch between the lobes here, between the pyramids, these renal pyramids, and these are these lobar segments of the artery that's come through. So you have lobar arteries that branch through. Okay. Now these lobar arteries, like I said, will go between these renal pyramids. And what do? They turn the corner like this. And they go around the renal pyramids. Now, when you take that corner, it's called an arcuate, okay? A turn, an arcuate. So these are arcuate arteries. Now these arcuate arteries have other branches that come off them in the cortex. Now these other branches that come off are called lobular arteries, okay? Lobular arteries. So remember, we have segmental arteries, we have lobar arteries or interlobar arteries because they're between the lobes, interlobar. Then we have arcuate arteries, and then we have interlobular arteries coming up through. And that's not the end yet, unfortunately, because these interlobular arteries have more branches coming off them like this. And this is where it gets to become very important, because these branches are no longer arteries, they are arterioles. Remember, arterioles are small arteries. And that these are the only ones I'm going to label for you, these smaller arterioles are called afferent arterioles. Okay? Why is this important? Well, remember, this blood comes in, branches into these afferent arterioles. And this is where we filter the blood in the cortex. And what we have in the cortex are the functional unit of the kidneys. So the structural portion of the kidneys that does all the filtering. And what this thing is called it's called a nephron. Okay? And you have, now what does a nephron look like? I'm going to wipe this off here and show you. A nephron looks like this. Has a little Pac-Man head to it, and then starts to look a little bit like a snake. That's what a nephron looks like. Now, this nephron, so let's write that down, N-E-P-H-R-O-N. This nephron, this little cup here, is actually here at all these arterioles. So that means if I were to draw it like this, we've got a nephron here, nephron here, nephron here, nephron here. So you've got nephrons everywhere. Now the thing is that you actually have, per kidney, around about 1 to 1.2 nephrons. So for both kidneys you have 2.4-ish nephrons, which means you have a great capacity to filter. Okay? So you can see, if I were to draw the afferent arteriole that's coming in, comes in like that, like you can see here, and then it forms this capillary bed in that little capsule, like that, and then pops out the other side. So, and here you have the afferent arteriole, like I stated, and on the other side you actually have what we call an efferent arteriole, which I'm going to talk in more detail in the next video. An efferent arteriole. And it's here, at this little capillary bed, is where all the substances from the blood that are small enough and are of appropriate charge can get filtered through. Okay, so this is important. So that means the blood comes in, it gets filtered, gets pushed through into this tube, which we call a nephron, okay? And we'll follow through the tube and go down this big tube here. Now this big tube here moves down into the renal pyramids. So if I were to draw a bigger nephron, so there's the capsule, there's the afferent arteriole, there's the capsule, there's the proximal tubule, goes down like this, and then moves down into the renal pyramid. Now, as it moves down into the renal pyramid, this is where the fluid starts to move down. So the urine that you've just formed moves down the renal pyramid, and like I said, drips into the minor calyx, then drips into the major calyx, and then goes out into our pee. Okay? So, this nephron is the site of filtration. The blood gets filtered and travels through this tube and comes out as pee. Okay? In the next video, I'm going to focus on the nephron and talk about exactly what happens. But what you need to know from this video is a couple of things. 2 kidneys, 2 ureters, 1 bladder, 1 urethra. The kidneys sit behind the peritoneal cavity, which we call retroperitoneal, at the level of the 12th rib to the 3rd lumbar vertebrae. Okay? It's surrounded by this structural fat called perirenal fat. It's there for protection and anchorage. And that the kidneys, if you segment it, if you cut it, you can see that it's made up of 2 major components, the cortex, which is the outer component, and the medulla, which is the inner component. The filtration happens in the cortex, and that the urine that's being filtered drips down into the renal pyramids and into these cup-like structures, which we call the minor calyx, and then the major calyx, and then out via the ureter. The way it gets filtered is that blood comes in through the renal artery, and this artery branches and branches and branches and branches. Branches into these segmental arteries, into interlobar arteries, into arcuate arteries, into interlobular arteries, and then into afferent arterioles. And it's the afferent arterioles that enter into the nephron as capillaries, and this is where the blood gets filtered. The nephron will take all that filtrate, the blood that's been filtered, and drip it down the renal pyramids for us to pee out. Okay, so hopefully that all made sense.